Let's make your knee replacement recovery smooth and pain-free with these helpful tips. Hi, Dr. James Vegher here, a doctor of physical therapy, here today to help you solve your joint pain issues. Right now, I'm going to talk to you about what you should absolutely avoid doing if you've had a knee replacement. But that's not all I'm going to do for you in this video. Simply stick around to the end so I can share a free gift I created for people just like you. I've compiled a series of movements, suggested lifestyle patterns, and tips to help you eliminate knee pain and keep it away for good. First of all, given the topic of this video, you are likely here for one of two reasons. One, you're about to have knee replacement surgery and you want to make sure you do everything you can to make it successful. Two, you have already had a knee replacement surgery and the rehab process is not going as smoothly as you would like. For those of you who are about to have surgery, what I'm about to share with you will be a great addition to what you're going to do in rehab and should only make the rehab process easier. For the second group, this video is truly for you. I know how frustrating it can be to go through the process of surgery, the planning, the anticipation, and the worry, all for a result that's less than desirable, painful, and frustrating. Not to mention having to go to often painful therapy sessions multiple times a week with a therapist that implies that you're just not trying hard enough. All this and you still show little to no progress in your range of motion or your walking. I know this because my clinic is the clinic in town that treats the clients that are not succeeding in other rehab. Now I need to warn you that some of the suggestions that I'm gonna make here and that I make to my clients all the time seem to fly in the face of what you've been told by your physical therapist and even by your surgeon. As you are probably aware, surgeons and PTs are both focused intently on making sure you increase your range of motion after most knee surgeries, but significantly so after knee replacements. With all of this pushing for range of motion, rehab providers often overlook basic facts of the human body, which can make it virtually impossible to make range of motion gains. So my first most important tip for recovery is stop pushing through pain and holding painful stretches for long periods of time. Many patients are told to put their heel on a table and then put a weight on their knee and let it stay there as long as possible. With all of this pushing for range of motion, rehab providers often overlook basic facts of the human body, which can make it virtually impossible to make range of motion gains. So my first most important tip for recovery is stop pushing through pain and holding painful stretches for long periods of time. Many patients are told to put their heel on a table and then put a weight on their knee and let it stay there as long as possible. Countless clients of mine have shared this story with me of how excruciating this is, but they do it anyway, even through tears or needing to take opioid medications only to make little gains and moreover, be told that they are not working hard enough. This couldn't be any further from the truth, and I believe you are working as hard as you can. In fact, you are working too hard. Let me explain. Your body is designed to protect you from injury. It's hardwired into your system. In fact, you can see an example of this phenomenon every time a doctor hits your tendon with a hammer to check your reflexes. You know, the doctor hits your knee with a little rubber hammer and your foot kicks out. It happens without you thinking. Your muscles are designed to fight a stretch by trying to get out of it. The quick hit of the hammer stretches your muscle, and your body responds by protecting it and fighting that stretch. In fact, there are a number of different sensors in your muscles, and they overwhelmingly use stretch as a way of determining how to respond to the situation, and the sensation of stretch puts your muscles in a state of high alert that damage is likely. So if you have a leg that has been cut into and sawed and hammered on, your body is already in a state of high alert or guarding. This means your muscles are in a state that is ready to fight stretch. Again, this all happens involuntarily. So if you are sticking your leg out straight and it hurts and you put a weight on it and you're gritting your teeth to get through it, do you think your body and muscles are allowing the stretch to happen, or are your muscles fighting with everything they can to prevent you from further damaging your knee? I can tell you, undoubtedly, it is the latter. So stop these types of activities immediately. You need to gently move your knee in ways that do not register a threat to your muscles and therefore will allow the knee to move easily, which you can see in part 2 of this video. That being said, there are times when the tissue stiffness is too great, or adhesions have formed or scar tissue is built up and a manipulation or other procedure is necessary. Thanks for watching. Be sure to check out part 2 of this video to see a gentle exercise that will give you results. As I promised earlier, I have that special gift for you. All you have to do is click the link down below in the description, and it's going to take you to a page where you can get access to my Healthy Knee Guide PDF. If you learned anything helpful, please share this video with a friend and click that thumbs up button. If you're new here, hit that subscribe button so you can get more tips and tricks for pain relief and corrective exercises. Be sure to leave me a comment letting me know how this worked for you or other pain relief tips you'd like to see. Until next time, take care of yourself.